Speech 2, Julia Montgomery. If there is a vaccine that could protect your child from the most commonly sexually transmitted disease, more specifically, there's a 70% chance that your son or daughter will become infected with this disease. This disease not only has a social stigma, but is also highly associated with the risk of developing multiple types of cancers. Would you vaccinate your child? If your answer is yes, then you are in luck because this vaccine exists. The virus we are talking about today is the human papilloma virus. By supporting Virginia House Bill 1614 to change the current guidelines of HPV vaccination from mandatorily vaccinating girls to additionally adding boys to the bill, you will help prevent the spread of this devastating virus. How many of you are aware that there currently is a mandatory guideline to vaccinate girls in the state of Virginia? This guideline was developed in 2008 when the vaccine was approved for women. It has now been approved for boys after multiple research studies. By adding boys to the mandatory vaccination guidelines, we will help increase compliance and spread immunity to the population as a whole. Over the past few years, many of you have already seen television commercials talking about HPV prevention and the Gardasil vaccine for women. The commercials and advertisements are now including boys in their criteria. The only vaccine currently on the market that has been approved for boys is the Gardasil vaccine. It covers males and females. It also covers several strains of HPV that affect both males and females. These strains are known to cause 90% of genital warts and prevent several types of cancer. Most importantly, this vaccine prevents cervical cancer in women. The American Pediatric Association also includes boys in their HPV vaccination recommendation, based on multiple conclusive studies that have evaluated that the vaccine is effective in preventing genital warts in males as well as several types of cancers. Genital warts is a condition characterized by pink or white cauliflower-like lumps in the genital area. These lumps are for life. Research has shown that although women are more likely to suffer from the devastating effects of HPV, it is men who are most often the carriers and spread the strain. By vaccinating both genders, the problem can be eliminated through herd immunity. The vaccine is a series of 3 shots given over the course of several months. Therefore, compliance is pretty easy to achieve when it is mandatory for those vaccinations to be received. You may think that HPV is not something that will affect your child. There is a high sexual stigma associated with the disease. However, HPV is silent, and many do not know that they are affected until it is too late. Years down the road, you may notice lumps or develop cancer. The most common symptom associated with HPV is the infamous one, which is the warts we've talked about earlier. There are about 1 million new cases each year, according to the CDC. They are for life, and even after treatment, they do come back. The Gardasil vaccine is 100% effective in preventing the strains of warts that it covers, and it is also 100% effective in preventing cervical cancer in women caused by those strains. Male cancers can also be developed by HPV vaccines, so males are not immune. The effect of HPV is commonly discussed in women. And there's pap smears, cervical cancer screenings, STD talks. However, the lesser known benefits of the Gardasil vaccine are the preventative factors for male. There's anal, genital, throat cancers that are common in men that are caused by the HPV vaccine. About 7,000 males are affected by an HPV strain. Oropharyngeal cancers are the most common in men and can be prevented by vaccination. According to the CDC, about 1 in 100 sexually active adults in the United States will have genital warts at any given time as well that can potentially develop into cancer. Mandatory vaccination is not a new concept. Our children receive a series of vaccinations prior to entering school and throughout the school year and during their lifetime. While most states mandate vaccinations such as hepatitis B, mumps, measles, rubella prior to the child entering school, the HPV vaccine still remains controversial due to the sexual stigma and the new research that includes males. You may be concerned that mandating vaccination arises issues regarding parental autonomy and sexuality of adolescents. However, studies have shown no link between the HPV vaccination and increased promiscuity in boys and girls. It is important to vaccinate these children early in their early teen years. 60% of women in college become infected with HPV in their first year. The early range of 11 to 12 hopes to catch children prior to beginning sexual activity with partners. For example, if a boy begins sexual activity at the age of 16 and a girl his age becomes infected with HPV, then all of the partners are at risk for catching and passing the silent virus for the rest of their lifetime. The vaccine will not help at that point. Vaccination in boys can also offer herd immunity for women against HPV later on in life. This means that if a large portion of the population is vaccinated against the HPV vaccine, it is difficult for the virus to spread because most of the population is immune and fewer people are susceptible to the infection. Herd immunity can successfully slow or stop the spread of disease in a community, and this has been proven over multiple mandatory vaccination studies. Securing vaccination status in school can also eliminate inequality by underserved children who will otherwise not receive the vaccine. This will create funding to vaccinate those with geographic or socioeconomic disparity. A study by Morita, Ramirez, and Trick found that mandatory school vaccinations dramatically reduce disparity in vaccination among different races. Funding may be an issue for this vaccine. However, it is estimated that the cost is about $400 per child. The Gardasil vaccine is a small series to pay for the benefits that we can attain over the long term. The Affordable Care Act of 2010 also covers this vaccine due to the mandate that private insurance will cover fully cover HPV vaccination in both males and females. Publicly funded programs such as Medicaid and Vaccines for Children program will also pull more resources to cover additional costs for children entering the 6th grade in the state of Virginia. The HPV vaccine seems to be a straightforward solution to a great health problem caused by an insidious virus. Although it is not an immediate concern when you're infected by the virus, over the long term it causes much damage to the individual and the community. The Need for Action by Ward and Patrick Hope sponsored this bill. The current law in the state of Virginia only mandates vaccination for females entering the 6th grade. The benefit of passing this bill to include boys in the guidelines are strongly supported by the American Academy of Pediatrics, American Cancer Society, and the Center for Disease Control. The amendment for House Bill 1614 reflects the new recommendations. Therefore, it is scientifically proven that this will work. Why is it not passed on to the bill? Implementation of House Bill 1614 is also a good time to reinforce sexual education and continue sexually transmitted disease screening throughout the lifespan. The vaccine will continue to be mandatory by grade and not by age, as there may be children of various ages entering the 6th grade. By crossing out 4 females, the immunization would order that both genders receive the HPV vaccine. The bill is now in the second phase of the policy-making process. It needs approval from the judicial body for adoption into legislature, which is where everybody here comes in to support this bill. There is a need for policymakers to protect the public from disease transmission. The challenge to mandate vaccination for females has already been solved. Why are we leaving our boys out of the vaccination mandate? Boys are just as likely to benefit from this vaccine. It is not a live vaccine, it is safe. The choices are clear. Making small investments to prevent the most commonly transmitted diagnosis, as well as various types of cancers, is worth it. Because truly, a vaccine that prevents cancer is a major milestone in medical technology and should be available for all those who fit the criteria. Anybody have any questions? No? Thank you.